Welcome back to Grip News 2M. We have a breaking health update for you today. U.S. health officials have reported the first case of a new form of Mpox right here in the United States. This latest development comes after a traveler returned from Eastern Africa. Let's dive into the details and understand what this means for public health. The first reported U.S. case. Health officials announced on Saturday that a traveler who had recently been to Eastern Africa is the first reported case of a new form of Mpox in the United States. The individual was treated in Northern California, and according to the California Department of Public Health, the symptoms are already improving. The good news? Officials say the risk to the general public is low. The infected person is currently isolating at home, and health workers are reaching out to any close contacts as a precautionary measure. What is Mpox? Now, for those who may not be familiar, pox is a rare disease caused by a virus closely related to the one responsible for smallpox. The virus is endemic in parts of Africa, where people can contract it from bites or contact with rodents and small animals. While the symptoms can vary, milder cases typically present with fever, chills, and body aches. However, more severe cases can lead to painful lesions appearing on the face, hands, chest, and even the genitals. New form of Mpox emerging in Africa. Earlier this year, scientists identified a new form of Mpox spreading in Africa, particularly in the eastern and central regions. This new strain was reported to spread primarily through close contact, including sexual transmission. While it has spread widely in African countries like Burundi, Uganda, and the Democratic Republic of the Congo, cases outside the continent have been limited, according to the U.S. Centers for Disease Control and Prevention. In fact, since late September, the World Health Organization has reported more than 3,100 confirmed cases, mostly concentrated in these three African countries. Global spread and vaccine needs. The new form of Mpox has also been identified in travelers from countries like Germany, India, Kenya, Sweden, Thailand, Zimbabwe, and the United Kingdom. Health officials are closely monitoring these cases to prevent further spread. In Africa, the situation is stabilizing, according to recent updates. However, the Africa CDC estimates that at least 3 million pox vaccines are urgently needed in Congo alone to contain the virus. They've also called for an additional 7 million vaccines to protect other vulnerable populations across the continent, including children, pregnant women, and other high-risk groups. Differences from the 2022 outbreak. One key difference to highlight is that this outbreak is not the same as the 2022 global Mpox outbreak, where cases were predominantly seen among gay and bisexual men. This time, the virus appears to be spreading more through close contact and sexual transmission among a broader demographic. The first U.S. case of this new Mpox form is a reminder of the importance of vigilant public health measures, especially with emerging infectious diseases. While the risk to the public remains low, officials are taking all necessary precautions to prevent further spread. What are your thoughts on this new health concern? Should more be done to control the spread of Mpox globally? Let us know in the comments below. Don't forget to like, share, and subscribe to Grip News 2M for the latest updates on health, sports, and breaking news from around the world. Thanks for tuning in. Stay informed, stay safe, and we'll see you next time on Grip News 2M.